Hi there, my name is Dr. Jin Eslami. I'm a board certified periodontist. That means I'm a gum specialist. Today, I'd like to speak with you about using rubber bands to move your teeth and aligning your teeth. A new trend that's going on is people are using rubber bands to close spacing in the front teeth, or if you have buck teeth, to put a rubber band from molar to molar and pushing everything in. If your teeth are moving with simple placements of rubber bands, you have a bigger problem. The problem is bone loss. You probably have some gum disease and bone loss if your teeth are just simply moving by placing rubber bands. Another thing is if teeth are placed and moved in certain positions, it can cause malocclusion, meaning the teeth don't come together nicely. And then lastly, if you're moving your teeth aggressively with strong, thick rubber bands, it can lead to more bone loss and then eventually tooth loss. So if you're unhappy with the alignments of your teeth, if you don't like the gapping, you don't like the way that the teeth are coming together, please see your dentist or orthodontist and let them help you.